everyone, welcome back to Gentle Dental. I am Dr. Sarah Chinnery, and today I am going to talk to you a little bit about dental specialists, who they are, what they do, and why you might be referred to one. And it may be more of a positive thing than you think it is. As I've mentioned before, as a general dentist, I'm trained to do a wide variety of things, whether that's exams, fillings, cleanings, extractions, root canals, orthodontics, dentures, and so much more. But sometimes your needs go beyond the scope of general practice. That's when I might recommend a specialist. A referral doesn't mean that something is wrong. It means that your dentist cares enough to get you the best, most precise care possible for your situation. Think of it as having a whole team of experts working together for your smile. When your dentist refers you to a specialist, you can feel relieved that your health is the top priority. A lot of people get anxious or frustrated that they have to go somewhere else, so I hope through this episode that you feel confident as to why your dentist referred you to a specialist, and also encouraged that you have a great dental team that cares for you. If you think of your general dentist as your primary care physician, the dental specialists are like any of the medical specialists, so cardiologist, ENT, internal med, pulmonologist, and on and on. Similar to medical specialists, dental specialists go through more school. So they finish dental school, and then depending on their program, they go on to more school to learn their specific specialty. And for most cases, they don't practice outside of their scope of specialty. We're going to be talking about a lot of different dental specialists today, so buckle up and let's get to it. For one, we're going to talk about the pediatric dentist, and that is also known as like the kid specialist. Pediatric dentists focus on children's oral health from infancy to adolescence. They provide preventive care, fillings, primary teeth pulping crowns, extractions, early orthodontics, and behavior management. I do want to caveat that there are some general dentists that are amazing with kids, and so it just depends on the general dentist's comfort level. And so if your kid is seeing a general dentist, then you are in good hands. But sometimes just behavior management, or if like they have 4 quadrants, so like upper right, upper left, and lower right, that's the quadrant. If your child has 4 quadrants of extensive decay, then sometimes what we'll do is recommend sedation, general anesthesia, so that they can go to sleep, get their treatment done, and wake up, and they don't have to remember anything. Everything is done in one visit, especially like if they're really young and can't sit in a chair very well. So there's lots of factors with that, but it just really depends again on the general dentist's comfort level and how experienced they are. The biggest thing with kids is that we want them to have a good experience. Pediatric dentists work on baby teeth all day long, right? So they're a lot faster than what I can do. And so if I know that they'll be able to get the child done faster and they'll have a better experience, then it's totally worth for me to refer to pediatric dentists so that they can have a good experience and not hate the dentist when they get older. So endodontists, you may know them for being root canal specialists. They focus on the inside of the tooth, and that includes the nerves and the root. Procedures they do can be anywhere from like root canals, retreatments of root canals if they failed, apicoectomies, which is the end of the root surgery. Why you might be referred, there are so many reasons, honestly. Every tooth is different to start with, so you can have different anatomy for each tooth that you have, and sometimes if you don't have like a 3D machine, a CBCT, it makes it really difficult to make sure that you have all of the canals. Sometimes there are 2 canals in one root, and so it makes things a lot more challenging. With all that said, it's also one of the only procedures in dentistry that you kind of have to go by feel, because you can't physically see like all the way at the bottom of the root most of the time. The nice thing about endodontists is that they actually use microscopes when doing treatment. They don't wear like the fancy loops that we do. They have actual like microscopes. I don't even know how many times X that they're able to see in, but they're able to identify a lot of more things than we can with the loops that we wear. Next, we're going to talk about our periodontists. Periodontists focus on the gums and bones. So they not only perform scaling root planning, which hygienists do as well, but they can do surgery, laser therapy, gum grafts, bone grafts as well, and they also specialize in placing dental implants. Why you may be referred to a periodontist? Well, again, lots of reasons, but sometimes if the scaling and root planning is not being effective, your pocket depths and things like that are not increasing at your general dentist office, then it is possible that there are some surgical interventions that the periodontist can do in order to get those pockets into healthy numbers. And they also have just a lot more tools than most general dentists do. If you also have gum recession, they are very important because they can do gum grafts sometimes, depending on the cause of what the gum recession is, but they can place connective tissue as well as gum tissue in the area to help with sensitivity and things like that. And the implant aspect, so they don't typically restore the crown part of the implant, but they are awesome at figuring out the placement of implants so that the general dentist can restore it. And they focus again on the gums and bones, so they place the implant so that you have the best shot at having a good gum around the implant crown. They also do like all-on-4s and things like that, so they are very, very important. The next one we're going to talk about are the oral and maxillofacial surgeons, and sometimes we just call them oral surgery. So these are very, very, very important people because they focus on a lot of different areas, even with trauma, and they just have a very wide scope of practice. Most people know them for extracting your wisdom teeth or your third molars, but they honestly do a lot of different things in the mouth, the jaw, and the face. So some procedures that they do, again, like I said, they do wisdom teeth extractions. They'll do surgical extractions, or just if you're using like a full mouth extractions, they can do that a lot faster than most endodontists. They can also place implants, same as periodontists. They do jaw surgery, especially in cases where like the jaw may be pushed back a little bit. They're actually able to, it sounds kind of gross, but they'll actually break the jaw and then move the jaw forward so that the bite is more in function, and also they work with the joint aspect of the jaw as well. They can do biopsies. If there's an abnormal lesion in your mouth, they can biopsy that and then send that to pathology. And then sometimes you may have just complex medical history that makes it a little bit more challenging for post-op complications, especially if you have like bisphosphonates, if you have osteoporosis, or if you tend to bleed a little bit longer or things like that. They have a little bit more experience on doing that kind of stuff. What they taught us in dental school, a lot of times if you have a severe car accident or something like that where things happen to your face, oral surgeons are usually called to kind of help piece that back together, as well as plastic surgeons. So they play a very, very important role. So they not only just extract wisdom teeth, but they do so much more. And next we're going to talk about orthodontists, which most people know. Orthodontists are well known because they have straightening and aligning teeth. Procedures that they typically do are like braces, clear aligners, second Invisalign, expanders, and bite correction. You can be referred to them if you have crooked teeth, bite issues, spacing problems, and sometimes they can even help with early intervention on sleep apnea in kids. Sleep disorders and orthodontics have recently kind of been working together to try and help with kids' airway and then like the palate formation. Prosthodontists are the next specialists that we're going to talk about, and they're a little bit less known. There's not very many of them, and so they focus on replacing and restoring teeth. Procedures include like bridges, crowns, implant restorations, partials, dentures, and then like full mouth reconstruction. Why you might be referred to a prosthodontist is if you've lost multiple teeth and maybe your bite has collapsed. A couple weird things that most people might not know is that if we are missing teeth long term, our teeth like neighbors and friends. So if we've lost our friend, then a lot of the time our tooth up top likes to make its way down to meet its next friend, which is usually the gum line. And then for the neighbor aspect, so if we lose one tooth and say this is where your mouth opening is, our teeth tend to shift and tilt sideways, and so it kind of makes things difficult. If you haven't replaced a missing tooth quickly, things can kind of start collapsing, so teeth start shifting, going sideways, and so it makes it a lot more difficult to try and restore things. We have to have a certain amount of space to be able to fit things in there, and so with all of that said, I always like to say sometimes one tooth can become a tooth problem, or even more if we don't restore those missing teeth over time. So prosthodontists are really good about about if people have waited a little bit longer. Well, even like they don't have any teeth, and our tongue also grows over time if we don't have teeth. So sometimes you'll notice if someone is a dentalist or doesn't have any teeth, their tongue is a lot larger than it used to be. So sometimes it makes it a lot more challenging to get those impressions to make a denture. There are some techniques that general dentists can do, but prosthodontists are typically a lot more savvy with trying to restore things that are a little bit more complex. And the same thing too with if your jaw is more forward and you're trying to get a denture made, a lot of times it's a lot more challenging, which basically means the top teeth and the bottom teeth sit like this. And so if our jaw is sitting like this, making a denture where it's not sitting correctly is usually really challenging. So prosthodontists are awesome at creating the best function option for patients like that. Next, we're going to talk about oral pathologists, which you may not even know that that's a thing, but diagnose like cancer, infection, and sometimes even like autoimmune conditions. The procedures that they're typically involved with are biopsies and microscopic evaluation of tissue. Why you might be referred to a pathologist is if you have a suspicious area that hasn't gone away and the dental dentist is concerned about what it's looking like. So they will send you for a biopsy, send you to the oral pathologist, and they will take care of diagnosing it. And the dental dentist is concerned with that. There's also a oral radiologist specialist. And so they focus on imaging like CBCTs, which is that 3D image, to diagnose conditions that are in the head, neck, and jaw. They would also look into radiographic interpretations of the TMJ, disorders, or lesions. There is also a dental anesthesiology specialist that is also not well known, and they do exactly what their name says. They work on anesthesia in the dental field, and so they focus on IV sedation, general anesthesia, things like that. A fun fact is that there was actually a dental anesthesiologist that taught my class how to give injections, and so I thought that it was a really cool opportunity to talk with one and learn from someone that's all they do. That's a fun fact. And then lastly, there is a dental public health specialist. They focus on improving oral health in community-based programs, so research and education rather than direct patient care. Things that you may recognize them for would be like fluoridation programs, oral health policy, and community outreach. So I hope you learned something today about dental specialists and that referrals aren't an annoyance, but they're an investment in you. It's like having a team of specialists for your mouth. Each person brings expertise to make sure the prognosis is the best outcome that you can have. When I refer you, it doesn't mean that I'm stepping away from your care. I'm still your dentist, your home base. The specialist steps in for their part of the puzzle, and then we come back together to keep your oral health on track. So next time you're here, we're going to send you to the specialist. Remember, it's not a bad thing. It's good news. It means your dentist is going the extra mile to make sure that you get the very best care. If you've ever seen a dental specialist, let me know in the comments what your experience was. And don't forget to subscribe so you don't miss future episodes that help you feel calm, clear, and confident about your dental care. Next week, we are going to learn from one of the pediatric dentists that I am so excited for you to learn from. So tune in next week. See you guys.